Hello, everyone, and thank you for joining us today for this presentation on public charge and farm workers. My name is Alexis Guild. I am the Senior Health Policy Analyst at Farmworker Justice. The goal of the presentation is really to familiarize you with how the public charge final rule will impact farm worker communities. We'll start with an overview of who are farm workers. We'll then talk about their structural issues, specifically their working conditions, living conditions, the discrimination they face, and other barriers to healthcare access. We will then talk about the rule itself. Specifically, we will be focusing on the totality of circumstances, the factors that make up the totality of circumstances, talking specifically about H-2A workers, and then we'll conclude with outreach strategies. So who are farm workers? It's important that we understand the farm worker population so that we can fully understand how the rule will impact them. So there are approximately 2.5 million farm workers in the United States and approximately 4 million if you include their families. Now, data on farm workers is limited, and a lot of this data comes from the National Cultural Workers Survey, which is a survey conducted by the U.S. Department of Labor. And according to this survey, approximately 76% of farm workers are foreign-born, the majority from Mexico, but a rising population from Central America, specifically Guatemala, Honduras, and El Salvador, and then a small percentage from other parts of the world. Most farm workers have work authorization. It's estimated that approximately 51% have some form of work authorization. That can mean a green card, a U.S. citizen. Approximately 5 to 10% of farm workers nationwide are H-2A workers, but that number is increasing. California has between 1/3 and 1/2 of U.S. farm workers. And in California, there are approximately 18,900 H-2A workers, according to the U.S. Department of Labor. H-2A workers are in the U.S. on non-immigrant visas. They are temporary visas. When they come here, they are sponsored by employers, and they must work for the employer who sponsors them. So they can only work for those whose name is on the application. That could be an employer, that could be a labor contractor who takes them from employer to employer, but their time in the United States, their legal status in the U.S. is tied to that employer. They are allowed to work in the U.S. for up to 10 months. There are various requirements that the employer must adhere to in order to have H-2A workers. This includes a minimum wage, and this varies by state. In California in 2019, the wage rate was approximately $13.92 an hour. The employers also must provide housing, transportation to and from their home country, as well as workers' compensation insurance. That does not mean that they have to provide comprehensive health insurance, only workers' compensation insurance. The vast majority of workers are from Mexico, and most are young men between 18 and 35 years old. H-2A workers are not allowed to bring other family members with them. They also do not have a path to citizenship. And so by many accounts, H-2A workers are actually the most vulnerable amongst the farm worker population because they tend to be more isolated, because they live in employer-provided housing, and because their status in the U.S. is tied to their employer. There are numerous structural issues that farm workers face, and I just want to deep dive into them a little bit more. So when we think about the factors of public charge, you can understand the structural issues that may impact these factors. So first off, I want to focus on the working conditions, and as I'm sure many of you are aware, farm workers work in extremely hazardous conditions. Farm workers lack job security. There is a real fear of employer retaliation if they want to go to the doctor, if they need to take time off because they have a sick child, if they feel that their rights are being violated. It's more likely to be hazardous and to come with low wages. Farm worker wages tend to be quite low. Many farm workers work by the piece rate, meaning that the amount that they earn is based on the amount that they pick, either by the bucket or the bushels, depending on the crop. There are protections in place to protect farm workers from pesticides, as well as to enforce occupational safety protections, such as access to toilets. However, the enforcement is often quite lacking. So even though these standards are in place, the lack of enforcement often means that workers may not have those protections. They may not have that access to toilets. They may not have that access to clean water. They may not have those protections in place to protect them from pesticide exposure. Their living conditions also tend to be pretty substandard. Overcrowding is a huge issue in farm worker communities. Farm worker housing can vary depending on where they live and the housing market. Some live in barracks, some live in mobile homes, some live in apartments with multiple families in a one-bedroom or two-bedroom apartment. Some live in motels. There are areas in California where H-2A workers are housed in motels as opposed to in employer housing. Some may also live in their cars or in tents. In the canyons of San Diego, there are examples and instances of farm workers living in tents. Because employers are required to provide housing to H-2A workers, some employers may also provide housing to other workers as well, to domestic workers, to U.S. workers. But farm worker housing, regardless of whether they're housing provided by the employer or other types of housing, they tend to be quite isolated from the rest of the community. And these poor living conditions often mean that workers are vulnerable to gastrointestinal diseases, urinary tract infections, conjunctivitis, lead poisoning, so on and so forth. There also tends to be discrimination, and there's, of course, discrimination against the workers who are Latino, who may be undocumented, but more specifically, beyond that discrimination, there's an increasing number of workers who are from indigenous communities in Mexico and Guatemala. And in their home countries, indigenous workers tend to be discriminated against by the majority population. Spanish tends to not be their primary language, and because of this discrimination that's inherent within their home country that transfers here to the United States, indigenous farm workers tend to have the lower paying, more dangerous jobs in the field. Some languages that the workers may speak include Mixteco, as well as Zapotec and Mum and Quiche, and so on and so forth. And indigenous languages actually tend to be more spoken than written. And as I'm sure you can imagine, because the dialects can vary even within the language itself, and because there's so many indigenous languages in Mexico and Central America, finding interpretation services can be quite difficult. So indigenous farm workers also tend to be more isolated than the general farm worker population. I spoke a little bit about the working conditions. I just want to go into a little bit more detail about the job-related barriers to their healthcare access. So as you can imagine, because many of the workers are much more isolated, the farms tend to be further away from the community. Many must rely on either their employer for transportation or on others for transportation, because they may not have their own transportation, and public transportation, especially in rural areas, tends to be inadequate if there's any public transportation at all. For migratory workers who move frequently from farm to farm, maybe they go from Southern California to Northern California, or perhaps they go from the Central Valley of California to Washington State, or they move across the country. That frequent moving means that they really don't have a strong relationship with their providers and their communities. And while they may be familiar with a health center in one community where they work and live, they may not know about the health center in another area, in another community, another state where they may go for work for maybe just a short period of time. And what that really means is not only do they not have that regular access to primary health care, but if they're experiencing chronic conditions such as diabetes, the lack of continuity of care can really impede their ability to manage their disease. Employers also don't really provide sick leave. As I mentioned, many workers, if they are sick or have a sick child, are not necessarily able to take time off in order to go to a doctor. They have to choose between the wages of that day or going to a healthcare provider. And some may actually fear that if they do leave, that they may be fired. So workers tend to be quite reluctant to seek medical care unless it's really an emergency situation. And then of course, agricultural work is not a traditional 9-to-5 job. So many farm workers work very long hours, and the hours that they work don't necessarily align with traditional business hours, with the 9-to-5. So the clinics may not be open when they're available at night, for example, or on Sundays. Of course, there are other barriers to healthcare access, poverty, which we'll talk more about when we talk about their income, and the assets factor in the totality of circumstances, cultural linguistic barriers, confusion about the U.S. healthcare system. Many may not be familiar with the U.S. healthcare system. Also, many farm workers tend to be extremely food insecure, and so they don't even have access to the fruits and vegetables that they pick that keep us healthy. And so many suffer from chronic conditions, including diabetes, hypertension, obesity, and asthma. But despite these chronic conditions, they don't necessarily access health care due to these barriers, as well as just a general lack of trust in healthcare, in the healthcare system, or in the providers in the area. So we gave an overview of farm workers just so everyone can understand who they are and what their barriers are. But now let's turn our attention to public charge. So we've talked about public charge in other modules. I just want to reiterate that public charge affects everyone, and that we will not talk specifically about public benefits. We actually will talk more about the other factors in the totality of circumstances. It says October 15th in this slide. The public charge final rule actually did not go into effect October 15th. Currently, there's a nationwide injunction as of the time of this recording. So we're not sure when the final rule will go into effect, but there are immigration statuses where public charge does not apply, and farm workers do have some of those statuses. And the public benefits, which other modules talk about, those are very important to think about. But again, there are other factors that we need to discuss, especially when it comes to farm workers. H-2A workers are susceptible to public charge. The public charge determination does apply to them when they apply for a visa at the consulate. And even though the consulate officers are under Department of State, the guidelines used by consulate officers will be revised to align with the public charge final rule published by the Department of Homeland Security. We have not heard of any H-2A workers so far who have been affected by the current changes, the changes that took place in January, in anticipation of the changes that Department of Homeland Security made to public charge. But we do anticipate that when the final rule does go into effect and when the Department of State aligns their public charge definition with the Department of Homeland Security public charge final rule, we do anticipate that there may be H-2A workers who may be impacted due to the totality of circumstances. H-2A workers are not eligible for any of the public benefits under the public charge final rule. They are not eligible for Medicaid. They are not eligible for SNAP. They're not eligible for housing. The employers have to provide housing to them when they come to the United States. They are eligible to enroll in health insurance through the same marketplaces, and they are eligible for subsidies in the marketplace. But that should not affect the totality of circumstances. They are not able to adjust their status while they're in the United States. So H-2A workers have no path to citizenship when they have their H-2A visa. However, some H-2A workers may have their visas extended by their employer once they're in the United States. So there may be a situation where the employer sponsors an H-2A worker for 4 months and then decides they need another couple months. And so they have the H-2A worker extend their visa. Now, under the final rule, the Department of Homeland Security will consider for those applicants who are in the United States on H-2A visa and who would like to extend their visa, they will consider whether that applicant received the designated public benefits, so the Medicaid, SNAP, housing, or cash assistance for more than 12 months in the aggregate within a 36-month period since obtaining their non-immigration status up until their adjudication of their application. But again, because H-2A workers are not eligible for Medicaid or SNAP or cash assistance, and because this determination will not be a future-looking assessment, they'll only look at whether that applicant has received public benefits, it is unlikely that H-2A workers will be impacted when they try to extend their visas. It could, however, due to the confusion between having their visas extended and what they will look like, as opposed to applying for a visa from abroad, I think that there's a potential for a lot of confusion, and all of the misinformation about public charge just generally could lead to increased vulnerability because the workers depend on their employer, and so they may be even more fearful of accessing any services because they may worry that any benefit that they receive may impact their ability to extend their visa or to apply for a visa if they plan to apply after returning to their home country. Remember, farm workers could have any immigration status. So farm workers can be U.S. citizens, they can be green card holders, they can be refugees and asylees, they can be H-2A workers, they can be DACA recipients, TPS recipients, and they can be undocumented. And public charge does not apply to all statuses. It only applies to those who are applying to become a lawful permanent resident and to those who are applying to enter the U.S. from abroad, for example, H-2A workers. So I want to deep dive into the factors under the totality of circumstances. Now, what they've done in the final rule is they applied definitions to these factors that have always been part of public charge: age, health, family status. These factors have always been part of the determination. But what the final rule did is they included a definition for these different factors and assigned positive and negative values. So for example, for age, they consider it a positive to be between 18 and 62. But if you're under 18 or over 62, that's considered a negative. For assets, they say that if you are below 125% of the federal poverty level, which for a family of 4 is approximately $32,000, then that's a negative. If you're above that threshold, that's a positive. Now, there are ways if you're below that threshold to overcome that negative factor and to turn it into a positive, but you have to demonstrate that you have assets that equal to 5 times the difference between your household income and that 125% FPL threshold. That's a lot of money, and that can be a lot of income when it comes to assets that, quite frankly, most farm workers will not be able to demonstrate. They also define education and skills, and they define a lack of a high school education as a negative and limited English proficiency as a negative. But if you have an employment history, that's a positive. So each person looking at the application, the adjudicator of the application, will have to look at these different factors, and they'll have to weigh them positive and negative, and then based on looking at all of these factors, age, health, family status, receipt of public benefits, assets, prospective immigration status, and affidavit of support. After looking at all of these factors, they will have to determine negative or positive. Are you likely to become a public charge? Are you likely to use one or more public benefits or not? That's essentially what they are doing. They're looking at these factors and determining if, based on these factors, if you are likely to become a public charge. There are these heavily weighted factors in addition to these positive and negative definitions within these other factors. So as you can see, there are more heavily weighted negative factors and positive factors. For the heavily weighted negative factors, they include the receipt of one or more public benefits as defined under the final rule, one or more public benefits for more than 12 months within any 36-month period, as well as being diagnosed with a medical condition that will require extensive medical treatment or interfere with ability to work and is uninsured and without any financial means to pay for those medical costs. As I mentioned, farm workers tend to have chronic conditions that are impacted by their living and working conditions. And very few actually have health insurance, as we'll see in a moment. So it's likely that some farm workers may actually be considered under this particular factor a heavily weighted negative factor due to the fact that they may have a medical condition, whether that is related to a chronic condition or related to something that happened with their work, if they have a cancer of some kind, if something happens to them, if they, any kind of medical condition that could interfere with their ability to work, and they're uninsured, which many are, that's going to impact a lot of farm workers. Many farm workers will likely kind of have that heavily weighted negative. In the positive, in the heavily weighted positive, you see there are only two factors. One being having an income above 250% of the federal poverty level, which for a family of 4 is approximately $64,000, and having private unsubsidized health insurance coverage, essentially employer-provided health insurance. And as we'll see, most farm workers do not have private unsubsidized health insurance. Now, some farm workers have enrolled in health insurance through the Affordable Care Act, and are receiving subsidies to lower their premiums and copays. Under the final rule, this is not considered a heavily weighted positive factor because it is subsidized health insurance coverage, but it's not a negative factor either. It's kind of in the middle. So it's good that they have health insurance, but it's not a heavily weighted positive factor because ACA insurance with subsidies is subsidized health insurance, even though it's private health insurance. Again, the person who looks at the application, the adjudicator, needs to determine the likelihood to become a public charge based on all of the factors and the totality of circumstances. So it's highly discretionary. So it's hard to say for any particular person what the adjudicator may say about whether or not they may be deemed a public charge, because it's so discretionary that it really depends on the person who is reviewing their application, that person's circumstances, the applicant's circumstances, and then looking at all these different factors, and ultimately from the adjudicator's side determining, okay, will that person likely use public benefits? So it's highly discretionary. Now, I mentioned that for farm workers, overcoming the negative factors will be extremely difficult. And I just want to demonstrate some data to show you why it will be so difficult. So, for example, the average household income for farm workers is between $20,000 and $24,999. So certainly below, if you are a family of four, below that 125% threshold, which again is about $32,000. 1/3 of farm worker families earn below 100% of the federal poverty level. We also have to take into consideration that agricultural work is seasonal. And so many farm workers are actually unemployed for parts of the year, depending on the crop, depending on where they're living, depending on their ability to find work. And the amount of work is available to them in that area. So for example, it's estimated that in the previous year, there were 11 weeks when farm workers had no work at all. And for some farm workers, it might be longer than that. So the seasonality of farm work means that their wages will be lower. Also, only 47% of farm workers have health insurance. And of that 47%, only 29% have employer-funded health insurance. So a very low percentage of farm workers have private, unsubsidized health insurance. And part of that is because only 18% of workers reported that their employer actually offered comprehensive health insurance. So it's not a benefit of farm work to be offered comprehensive health insurance. And then, of course, farm workers tend to be limited English proficient. Approximately 62% of farm workers reported low or limited English proficiency. And they tend to have less than a high school education. The average education level is 8th grade. So if you look at those different factors, generally, this data demonstrates that it can be very difficult for a farm worker to overcome those negative factors and to not be deemed a public charge, even though many farm workers really have no intent of ever using public benefits. So even if they have no intent of using public benefits, they still may be deemed a public charge due to these various factors. So how do we do outreach and education to farm workers around public charge? The chilling effect, as it's affecting every other community, is impacting farm workers. We've heard from health center staff, from migrant seasonal Head Start staff, from others in farm worker communities that farm workers and their families are reluctant to access services, that some parents are disenrolling children from Medicaid, from SNAP, and from other benefits to which they are entitled due to fear around public charge. So how can we get the message out to farm workers about accessing public benefits, accessing the resources in their communities, and helping them be safe and healthy? Well, the most important strategy for farm workers is to bring the message where they live and work. As I mentioned, farm workers tend to be more isolated. They tend to live in employer-provided housing or housing that is far away from the general community, and they may not have much access to the different resources in the community due to that distance and due to a lack of transportation. So the most successful messages are those that are brought to the workers at their housing, at their work sites. You can do this by developing partnerships with health centers and legal services organizations and other community-based organizations that already provide that education and already are familiar with the farm worker community and know where the farm workers live and work. I do have growers down as a potential partnership. I just would warn you to really assess the situation in your community. Every community is different, and developing relationships with growers can be difficult and actually may not be appropriate in every situation. Some workers may find it intimidating to receive information about public charge from their employer because of that reliance on their employer and fear of employer retaliation. But on the other hand, some community organizations have had success partnering with growers, and it can make it easier to access the workers to provide that education. So my advice to you would be talk with your other partners in the community, the legal services organization, the health centers, community-based organizations, to find out, is it appropriate to reach out to the grower, or should we just work more directly with a community-based organization? It's also important to send trusted messengers to provide the education, promotores de salud, community health workers, outreach workers from community-based organizations. Oftentimes, especially for the outreach workers, the community-based organizations, and the promotores de salud, they tend to be from the farm worker community. So they know the farm workers, they have that trust built with the farm workers, and so they can more easily go into these communities and share information and be that warm handoff between the worker and your services. Also, because educational levels tend to be low, and because of the growing indigenous population who themselves may be not only limited English proficient, but limited Spanish proficient, it's important to develop easy to understand materials, graphic materials, materials that have a lot of color and design and easy to follow, and that also respond to the unique needs and concerns of farm worker communities, because what you may develop for a Latino community in San Francisco may not necessarily be the same needs and concerns of the farm worker community in the Eastern Coachella Valley. So it's important that the materials are developed with the farm worker in mind. If you have any questions about any of the materials presented, about farm worker communities generally, about public charge and farm workers, please don't hesitate to contact me. My information is on the slide. My email is aguild@farmworkerjustice.org, and I'd be happy to provide any follow-up or additional information. Thank you so much.